Hello, my name is Stacy McDaniel-Wesche, and I'm a registered nurse appearing before you, the Maryland General Assembly, on behalf of my community and the mental health community of Maryland at large. On any given day in the state of Maryland, individuals may require some type of mental health treatment and services, whether it be an outpatient appointment, an evaluation at a local medical center, and crisis stabilization, rehab services, respite care, forensic treatment services, partial hospitalization, intensive outpatient services, a crisis bed, a day program, and community outreach, mobile treatment services, or utilization of a crisis hotline. A multitude of treatment services are required at any given time of day in the state of Maryland. In order to give you a better understanding of mental illness, these are medical conditions that disrupt an individual's feelings, thoughts, and moods, and the ability to relate to others and interact at a functional level with their environment. The National Alliance of Mental Illness reports that 1 in 17 Americans lives with a mental illness. The National Institute of Mental Health reports that 1 in 4 adults, or approximately 57.7 million Americans, experience a mental health disorder in a given year. Now, my time before you here today is to discuss the dire need for resources, specifically funding, to support the mental health services required to meet the needs of the individuals with mental illness in our Maryland communities. The Department of Health and Mental Hygiene has passed their fiscal 2013 operating budget. And they have eliminated purchase of care bed funding to the extent of $2.1 million. Now, what this does is it puts the hospital bill of the uninsured individual for a psychiatric admission back on the individual to its entirety. Before, a purchase of care bed would would cover part of that bill by MHA would cover a portion of the fee and pay the hospital a part of that and cover the other portion and pay the physician. Now, I am proposing that MHA pick up that $2.1 million and help those individuals out. The majority of these individuals who are being covered before either do not qualify for Medicaid services, Medicare, and are not able to afford private insurance. The DHMH has hastened to close 88 assisted living care beds at Spring Grove, which is a state-run psychiatric facility. And these are considered step-down placements for patients in state-run psychiatric facilities who no longer need hospital-level care but are either not considered fully ready to go back out into community placements or were difficult to place. Well, now they're out in the community. This happened July 1st. Interestingly enough, the MHA had increased these types of beds several years before because they considered it as cost effective. This is because of the fact that communities are strained with the amount of resources and lack of funding. This is extremely poor and of negligent planning. The one thing I will give the MHA some credit for is that they have transferred $196,000 back into community services to cover their treatments which covers 2 months of care, while also stating that they are saving $618,000 by closing these beds. I do propose that they consider transferring additional monies back out into the communities to help assist the additional treatment that these communities are taking on from these 88 patients. The communities were initially strained prior to taking on these extra individuals. Without the monies, it's hard to add on additional services and individuals without the proper resources. You're looking at the possibility of hospitalizations because of crises coming up. In the Tri-County area of Worcester, Wicomico, and Somerset, where I work and live, I am seeing hardworking mental health professionals with exhausted resources all the time. Our hospitals are inundated with patients waiting for psychiatric beds, and you'll hear them say that I can't get in to see a doctor for several weeks. I can't get my medication, and for that reason they seek an inpatient stay in order to stay safe. And that is in essence telling us that our community resources are once again lacking. Our hospital diversion teams work hard and meet regularly to create new solutions to prevention and deal with the crisis, particularly with individuals out in our community that seem to be at risk for ending up more regularly in the hospital. And our core service agency depletes its funding for medication soon after the fiscal year has begun, despite frugality. Regardless, the CSA benefits our Tri-County area by locating state beds for psychiatric services from hospital to hospital, and they help resolve other issues as necessary. And they're a fine resource that we can't live without, but without necessary funding, that community asset cannot continue properly. Other services out in the community, such as Go-Getters and Lower Shore Clinic, offer services to low-income and uninsured individuals to mental illnesses. However, our community cannot grant access to each person in a timely fashion. Oftentimes it's 4 to 6 weeks before an individual can get an initial an appointment with a psychiatrist. We have a shortage in our community. Retention is a problem, and recruitment is even worse. The mentally ill in our communities need more access to services in our area, and we need to be able to provide programs which include adequate staffing, materials, and other resources. When we provide treatment, education, and coping and enable people to do more for themselves, they succeed. And without treatment, the consequences of mental illness for individuals and society are staggering. Unnecessary disability, unemployment, substance abuse, and homelessness, inappropriate incarceration, suicide, and wasted lives. The economic cost of untreated mental health is more than $100 billion each year in the U.S. So what I am proposing to the Maryland General Assembly is to increase the mental health funding to the community and allow grants for services, continue contractual positions for the fiscal year 2013. Our communities are underserviced and lacking essential resources to provide for those in need. With ample resources, professionals working with the mentally ill population, we can significantly reduce inpatient admissions and increase the quality of life. And the best treatments for the serious mental illness are highly effective. Between 70 and 90% of individuals have significant reduction in symptoms and improved quality of life with a combination of pharmacological, psychological treatment, and supports. Thank you for hearing me today on behalf of the mental health community of Maryland. Please consider increasing funding of mental health projects and grants